Good morning and welcome to Sinai Question and Answers, Sinai Seminars. My name is Dr. C.A.Botchway. Thank you so much for joining me this morning, and thank you for sending in your questions, which we're going to be answering right away. Okay, the very first question that we have is clenching. I'm suddenly clenching my teeth. Why is this? Friends, clenching of the teeth or grinding them together, especially in the night when one is asleep, is known in dentistry as practice. Okay, now friends, you might agree with me that as human beings, we tend to like going down paths and routes that we've been before. We feel comfortable and we feel confident going down those paths. But sometimes in life, we are forced to go down unfamiliar paths. We're forced to navigate pathways whose destination we are unfamiliar. And with most people, this elicits an emotion or a state of being called anxiety. To give you an example of this anxiety, you may have experienced it if you've ever had to get to a birthday party on a rural road with no GPS, no real directions, no signposts, and you had to get there before the party ended. That feeling you were experiencing as you were driving through the dusty road, that's called missing all the signs, that's called anxiety. Anxiety and fear lead to the state that is commonly known as stress. Bruxism, that is grinding and clenching, occurs in periods of extreme anxiety and or stress. So what happens during this time? So physically, the internal environment is changed. The muscles are not at rest. When you clench, you'll see this muscle here, the masseter muscle, you'll see how when you clench, it becomes rock solid. You can feel it and try and do that. So your muscles are not at rest, and the forces that are elicited traumatize and damage the tissues that hold the teeth in the jaw. They're huge forces, very, very powerful. Secondly, what happens mentally? Well, your thoughts are stuck in this cycle of fight and flight, fear and fight and flight, even as you sleep. And so you're mentally still going through that cycle. And as you dream, you may not go into REM sleep. That's sort of something different, but mentally, your mind is not at rest. Your body is not at rest. Thirdly, at night when you sleep, your soul and your body are in so much turmoil, they're totally overshadowing your spirit. And so your spirit's affected too. How can we check out if perhaps you have been clenching? How do you know? Well, one of the quick little tests that we do is your tongue. If you are at rest, your tongue is nicely above the teeth level, and when you stick your tongue out in the morning when you wake up, you should find a nice N-shaped happy tongue that looks like this. However, if you have been clenching your teeth, grinding your teeth all through the night, you might find that you have an unhappy and scalloped tongue. In the morning when you stick it out, it looks like this. There you go. All right. Okay, so what can it do? What does this clenching and grinding, what in the night, what does it do? Well, first of all, it can damage this very important joint. See, for me to talk to you and open my mouth, this temporomandibular joint here needs to be in tip-top working order. Well, that can traumatize the TMJ joint. Also, the muscles here can be traumatized. The muscles of the face, the muscles that I use to chew, and they can be sore, and I can wake up in the morning and they're pretty sore. So traumatization of TMJ and also the muscles here. The third thing can be the teeth. As I told you, teeth can get chipped. In some extreme cases, they can actually even get cracked, and they can even die. So what do we do when someone is grinding? First thing, if the grinding is simply related to the appearance of a new pathway, the negotiation of a new pathway, once the pathway has been successfully negotiated, that propensity to grind goes away. If it does not, then we would monitor, assess, and perhaps make what we call a night guard or a splint. Now the night guard or the splint simply stops you from traumatizing your TMJ, your muscles, and your teeth as you sleep. It does not touch the stress. If the root cause is anxiety or fear, stress, then to deal with the problem would be obviously to deal with the root cause, which is the anxiety or the fear, which is stress. Sometimes it's just as easy as reaching out to somebody who's walked that path ahead of you. That's why our elders are so important, or someone who's walking that path with you. That's why friends and family is so important. Sometimes it's just as important as that to know that you're not alone, you're not walking it alone, and this path will be negotiated, and that you are not alone. Together, we will overcome this season. However, for specific tools that can help you with stress and anxiety and fear, all of them mixed together, please go to our website, www.sinaident.com, and please watch our series, Fear Not. Okay, so I have only time for one more question. I have run out of time. I think I spent a little bit over the time limit on that question, but it was important. So my last question is, I need a cleaning and a checkup. Can I come in for that? And cleaning and checkups are extremely important, but the answer is, at this present time, no. It is not part of the emergency mandate that our Alberta Dental Association and College has mandated for us as part of our effort to contribute to social distancing and to public health guidelines. We are not doing any non-emergency work. So what I do advise, though, is everyone in our Sinai community is properly outfitted with our prevention regime. If you don't know where it is, check your emails. If you don't have them specific to you, please email me or call me, and I will be happy to send them out to you again. Once you are doing your prevention regime, which of course you know is the brushing, flossing, tongue scraping, water picking, and avoiding sugar, avoiding processed foods, making sure your nutritional supplementation is up to scratch, and all of the other things that are specific to you that would be in your custom prevention regime, you will make it through till we are open to see you for regular cleanings. Okay, that's it, Sinai community. Thank you so much for spending your time with me and watching this. Please do not hesitate to send me in any of your questions that you have. I will be here again next Friday at 8:30. And please do not hesitate to go to the website, www.sinaident.com, and to access the seminars, Fear Not, on overcoming fear. Have a wonderful, safe weekend. God bless you, and we'll see you here again next week.